What is tPA for stroke treatment? Imagine suddenly losing the ability to speak clearly or feeling weakness on one side of your body. These are signs of a stroke, and quick action can make a huge difference. One of the most important treatments for certain strokes is a medication called tissue plasminogen activator, or tPA. This medication is used specifically for ischemic strokes, which happen when a blood clot blocks blood flow to part of the brain. tPA works by helping to dissolve that clot. It is a special enzyme that activates a protein in the blood called plasminogen. When plasminogen is activated, it turns into plasmin, which then breaks down fibrin, the main protein that holds blood clots together. By dissolving the clot, tPA restores blood flow to the affected brain area, which can reduce brain damage and improve the chances of recovery. Timing is everything with tPA. It is most effective when given as soon as possible after stroke symptoms start. Medical guidelines recommend administering it within 3 to 4.5 hours from when symptoms begin. The sooner it is given, the better the chances of dissolving the clot and preventing long-term disability. However, giving tPA too late can increase the risk of serious bleeding in the brain, which is a dangerous complication. Not everyone with a stroke can receive tPA. Doctors carefully evaluate each patient to decide if it is safe. They look at how long ago symptoms started, the patient's medical history, current medications, blood pressure levels, and brain imaging results. Certain factors make tPA unsafe, such as recent major surgery, active bleeding, very high blood pressure, or evidence of bleeding in the brain seen on scans. These are called contraindications, meaning tPA should not be used in those cases. tPA is given through an intravenous line in a hospital setting, usually as part of an emergency response to stroke. The process involves rapid assessment, imaging tests to confirm the type of stroke, and close monitoring for any complications. Sometimes, if the clot is large or not fully dissolved by tPA, doctors may perform a procedure called mechanical thrombectomy. This involves physically removing the clot with a special device to restore blood flow. In summary, tPA is a vital, FDA-approved treatment for eligible stroke patients. It works by enzymatically breaking down blood clots to reopen blocked arteries in the brain. Its use depends on strict protocols to ensure safety and maximize benefits. Remember, if you or someone else shows signs of a stroke, acting quickly and seeking emergency medical care is essential. Always consult healthcare professionals for personalized advice and treatment options.